Dave Chase, CEO of Health Rosetta. Welcome to the podcast. More health, less healthcare. You have a fascinating case study in this book. It's one of the most interesting case studies I've ever read. And you make, a lot of very bold statements and even provocative statements. And I wanted to start with one that really caught my attention. I want to make sure I read it correctly. Healthcare killed the American dream. That's a pretty sweeping statement. How do you back that up? What is your sense of it?
Yeah, really at the core of it is for more than half of Americans, adults that are working age, basically working in middle class, the data is exceptionally clear. Every dollar and then some uh, that the workforce has gained, the working and middle class has been more than eaten up by increased health premiums, cost sharing, all of that. So basically, the big aha moment for me was when I connected the dots. It was March 9th, 2016, woke up to the news that Bernie and Trump had won the Michigan
Yeah.
primary, and that was quite a surprise. And that was
Yeah.
the first time I really remember hearing term populism, and they rise when there's economic depressions. Well, economic depressions, one definition is 2 or more years of wage stagnation or decline. So by that definition, we had way over 20 years. Now we're at about 30 years of wage gains being stolen. It's pretty hard to achieve the American dream if you can't, save for a rainy day, let alone save for college or retirement or anything like that. And that's, half of households don't have $1,000 in savings now.
You've made your point. Let me expand on it. So one of your solutions that you came up with was this company called Health Rosetta.
Yep.
And especially the Rosetta dividend was really intriguing to me. But go back a couple of steps. You had this aha moment, and then somehow Health Rosetta rose out of the ashes. How did you get to there, and what is Health Rosetta about?
Yeah, I mean, fundamentally, I believe that people are problem solvers the world over. And the idea was as I unpacked the many dysfunctions that existed in healthcare and having spent much of my career in healthcare, it always came back to the way we pay for healthcare, which is
Mhm.
called health plans or health insurance. It governs everything in healthcare. Um, None of it's an accident. It's all codified in these legal documents that may as well be Egyptian hieroglyphics. And so I was like, well, who's cracked that code? Um, and indeed, there were organizations like Rosen Hotels that had done that and had
Yeah.
done it for so long and so well that they'd saved so much money that they could easily afford to not only grow their business debt free, unlike other hotel companies, but have the best employee health benefits plan and then pay for college education for the employees and their children in the nearby once crime-ridden neighborhood. Like, it's like, wow, that sounds like utopia compared to what we have here. And so that's where this concept of the dividend came in because those of us who've been in healthcare, we've heard for years, whether it's the National Academy of Medicine, PwC, that 30 to 50% of all healthcare spending is waste. Well, we saw in their case, they're spending less than 55 or 55% less per capita, even though they have a very significant disease burden. Just give you one data point, 65% of their pregnancies are categorized high risk, yet they they chose not to squander the money that most have squandered. And the clinicians only get 23 cents of every dollar in the
Yeah.
US healthcare system. It's the rest of it that's expensive, the profiteering, the price gouging, the administrative bloat, the fraud, and some inappropriate care. And when you minimize or eliminate that, then suddenly it's very doable to fund college education and daycare and home solar and summer enrichment programs for your dependents and the sort of things that are now happening hundreds, even thousands of times in our community.
I mean, Mr. Rosen, it's fascinating. human being.
Yeah.
How did he come to the realization he wanted to give back to the community? Then, even more so, why education? It could be housing, it could be any number of things. Why did he choose education, and what's been the impact? It's been
Yeah.
phenomenal impact.
Yeah, he's one. He grew up as a immigrant child, Lower East Side of Russian, I think Russian immigrants, Jewish, and he, challenging upbringing, but then education is what really let him achieve the American dream. Of course, he worked super hard and took some risks, and he just saw the unlock that provided for him and people he knew, and he really cares about his community and his workforce. And basically, it's not a state secret, right? You invest in early childhood, in maternal journey, in education. It's probably the highest return on investment you can invest anywhere in terms of health. And so he's just a very common sense guy, and just did it brick by brick. And turns out he created something really special out of born out of frustration when he got some, really high premium increase, and basically told, like, even though they hadn't had bad claims or anything like that, like, oh, the pool you're in had bad claims. Like, what? Like, I'm a swimmer. I didn't know I was in a pool. And so he just was done. And he just didn't know anything about healthcare, but he figured, yeah, I've solved other tough problems. He didn't know how to build hotels at one time, or hire big teams of people, or do marketing, or any number of things. And so he just applied that same problem solving into healthcare and did it remarkably well in some really tough circumstances.
We cited some graduation rates right across the board over a number of years. It's in the
Yeah.
thousands of kids now. Is that right?
Yeah, yeah. Well, yeah, and this community called Tangelo Park,
Uh,
and then followed by Paramore, and I forget, they just adopted another one. I don't know their name yet. Yeah, they had very poor high school graduation rates, but once they said we're going to fully fund daycare, pre-K, after-school programs, and college educations, um, boom, some years, literally, if the kids out of that neighborhood who are given the promise, if they graduate, they're going to have um, college fully paid for, whether it's a
right.
two-year vocational or a four-year, Florida State or whatever. Basically, it's got to be in-state.
You
Um,
also mentioned, Pfeiffer. What was the story with Pfeiffer?
yeah, Pfeiffer.
Different story, but what was the application?
Yeah, a lot of similar things where they're a manufacturer. They do the like screens that are lawn furniture and keep bugs out and that type of thing. And they need to compete internationally. They're like many manufacturers. They use Lean Six Sigma, and they're all of a sudden like, oh my gosh, this healthcare thing is making us uncompetitive. And so they just applied that um, kind of supply chain methodology into healthcare. And they were early in that journey and trying to figure it out. And coincidentally, I just interviewed Russell DeBose, who's the VP of HR. It was exactly 10 years ago when he was kind of given this, well, when they had the data, and then they really, over the next year, he took over responsibility, and somebody's, said, "Oh, you sound like a Health Rosetta person." He's like, "I've never heard of what you're talking about." And he gave him the book, the first book I wrote, and it was like,
Sure.
boom, I'm gonna have a blueprint. And so they had developed a 7-year continuous improvement plan, and they're 6 years straight of no premium increases. Like Rosen, they've used the savings to fund college scholarships, summer enrichment programs, remove cost sharing for medications. They're now doing like a wellness and GLP-1 program. And, each time I talk to him, he's like, "Hey, I got a new dividend I want to tell you about." And the last one, I just saw him a couple months ago, and he's like, "We found that our retirees, who they didn't have actually any responsibility for, we found that 300 of our retirees didn't have a primary care medical home. They're in Alabama. It's kind of a primary care desert." And they said, hey, we've got extra capacity. You can just start using our clinics, that we use for our employees and dependents. And so they just continue to, a lot of people are getting horrendous premium increases this year. They had a 7% decrease in their spending, against that backdrop.
All right, so whether it be Rosen or Pfeiffer Industries, whoever the employer is, how big could the dividend be? What are we talking? 2%, 10%, 15%? Let's
Yeah.
say that they're all in.
Yeah.
How big
Yeah.
would it be?
Well, it kind of goes through depends on how much they tackle right away. And a lot of the case, like in the case of Rosen, it wasn't that in their case, because they've been doing it so long, that their spending dropped by 50%. It was just everybody else's spending went way up and they would benchmark against. Whereas if you're just starting now, and again, most people aren't going to rip off the Band-Aid and do all the things all at once.
Sure.
There's maybe 15% that will do that. But we have numerous examples of, I mean, it's pretty much a layup. You can get a 20% reduction if you're on top of it, and particularly starting with things like your drug procurement, so-called PBMs. The shenanigans there and profiteering are extreme, so it's quite straightforward to get a lot of savings there. But we see many, many, many examples of companies spending 20, 40, even 60% less per capita. So it just depends on how long you've been doing it, what you've done it first. The PBM arena is one where it used to be 15% of your spend was on drugs. Now it's not unusual for it to be 25, 30%. And then you can usually cut that by 30 to 50%. So if it was as high as 30% and you cut it in half, that's not a small number, just out of the pharmacy area. And so again, it just depends on what you tackle. The biggest savings for sure are on the medical claims. That's where the majority of the spending, and hospitals are regularly charging 5 and 10x Medicare rates. And all the time they're charging, 3 times Medicare rates. In my community, the hospital is charging just under 4 times Medicare rates. And they don't have particularly great or exceptional outcomes. And so you just want to make sure you get the right diagnoses. There's really high rates of misdiagnosis, and then go to the places that have low complication rates, low redo rates,
Sure.
uh, and you can get the savings quite readily.
So if an employer wants to jump in, what are the 4 or 5 things they can do right off the bat?
Yeah, I mean, the first one is, and it's important to say, I mean, the first thing is just mindset shift. Like, believe you can do it, because a lot of people just have been defeated by the system. But once you overcome that, and that's actually the biggest hurdle, um, the 4 of the 5 steps are invisible to the member or clearly a positive. The first one is this master key that unlocks the other doors, which is look at the contracts. We found that 95% of employers never look at these contracts. They treat them like I treat terms of service on some consumer website. Check, I agree. And they've just given a blank check to the industry. And so we found an organization by doing that and watching claims, again, before changing networks, direct contracts, any of that stuff, started watching claims. They found $1,000 per employee per year of savings kind of before they did anything. And that was $1 million because they're a 1,000-person company. And then the next step we talked about, the PBM, where even before you change the formulary or people pick up medications, you can get a lot of savings. You can get more savings if you get rid of junk drugs. Like, I call them junk drugs. Take 2 off-the-shelf medications that might cost you $14, put them into one pill and charge 3,000 bucks. That's not a good stewarding of your money. And so, those types of things get pulled out of a formulary because they're just a profiteering scheme. And then the first thing that people definitely will notice is advanced primary care, putting that in. And,
What is
the
that?
low. What's
What
that?
does advanced primary care
Yeah,
mean?
advanced primary care, um, it's sort of, you know, um, two parts Marcus Welby, one part Steve Jobs, right? It's in some ways the way care was at one time, but
Yeah.
apply some technology. Two-thirds of the time, docs, not just primary care docs, will say, I don't need to lay hands on you to be useful for you, but I just force you to come in because that's the only way I get paid. So you remove these silly distortions, and you reduce these ridiculous so-called productivity targets so that they can be milk in the back of the store to drive people to high margin activities. And you have regular access, you have longer appointments, you don't have perverse incentives to get people to be overtreated and over medicated. Like Rosen, we talked about earlier, they never had any anti-opioid program. But when I wrote my second book, which was called The Opioid Crisis Wake Up Call, I went back to them and said, "Hey, what's the story on your opioid prescriptions?" They have physically demanding jobs. They've got maids, maintenance workers, and they're like, "Oh, well, I don't know. We'll just pull the data." Well, their prescription rates were at 1/6 of the level of a typical employer in the US, just which basically puts them at France or Italy, like kind of a normal country, normal prescription rates. And lower back pain is the second most common reason people go to the doctor. We absolutely botch it. And so when you have time and when you have advanced primary care, you have time. It's a multifunctional team. In Rosen's case, they've got PT, chiro, health coach, dietitian, of course, doctors, nurses, and pharmacists, all in that setting. And like a number of places around the world, when you have that type of primary care, fully 90% of the issues people enter the healthcare system for can be fully addressed. And that's just pretty unusual in the US. It's fortunately getting less unusual. So that's what advanced primary care is. It's kind of team-based, proactive model, not that you're just a cog in the machine to get people to, you know, lumbar fusions and opioid prescriptions and MRIs and all that. Those things all have their place, but far less than what we do. Um, and then, the final thing is cut out value extracting middlemen, right? We have direct contracts with hospitals, with ambulatory surgery centers, with imaging centers, and the math's pretty simple. An employer would happily pay 100% of a $500 MRI than 80% of a $5,000 MRI. And those are like real numbers out there. And so, candidly, you don't have to be that good. You just have to pay, you have to care and pay attention to get these kinds of savings.
Does that relate to your centers of excellence? Do you wrap that at?
Yes, yeah, because the misdiagnosis I alluded to earlier, that's really where the big dollars are spent. Easily 6 to 8% of the members can consume 60, 80% of the
Mhm.
dollars. We
Right.
see 20% misdiagnosis rates on cancer, up to 67% on musculoskeletal. And so that's where you need to get people for those kind of outlier members that are, really serious events. Make sure they get the right diagnosis. I mean, unfortunately, it was kind of like, if you want to say what was my radicalizing event, it was what the system did to a friend of mine. Wrong diagnosis, course, wrong treatment plan, bankrupted her, ruined her, physically and emotionally, leaving behind a 10-year-old daughter. And sadly, that's not unusual. Cancer diagnosis basically means a coin flip that your life savings are going to be drained. Like it's not bad enough to get cancer.
You made another very provocative statement, which I want to focus on.
Yeah.
Make sure I get this right. That you don't really need an insurance company to manage risk. Why not?
Well, what we think of as traditional insurance companies, that have, sponsor the ball games and all that,
Yeah.
they're really expensive claims processors. Really, employers are tiny insurance companies in a way that they're managing 80% of the risk. The real insurance in health insurance um, are these companies that are called stop loss insurers. It's kind of those shock claims, right? the premature births, the rare cancers, the hemophiliac, right? These are the really insurable events. The rest of it, over a relatively modest number of lives, is just a budgetable set of things, right? You know you're gonna have a certain number of MRIs, primary care visits, prescriptions, all that. To put that through an insurance bureaucracy would be like pulling out your, auto insurance when you go to Jiffy Lube. It just, yeah, if you want to pay 2, 3, 5x, go for it. But if you actually want to steward your money and your employees' money, which by the way, you have a legal duty to do, then you really don't need these carriers who just carry your money from place to place, and grab big chunks of it out along the way. And sometimes they're referred to as payers, which is a real marketing coup on their part. It'd be like calling H&R Block the taxpayer. No, no, they're just telling you where to send your money. They're not actually the payers. We are all the payers.
One of the things that Rosetta offers is a plan grader. What
Yeah.
is a plan grader and what's the impact of a plan grader?
Yeah. We just thought it was odd that, I could pull out, we're on screen here is like this little big pen. There's 55,000 reviews on Amazon for this pen. 20% of the economy, there's not an objective mark of value. This is pretty crazy, right? Why aren't we assessing the value? We rated, Uber driver, they rate us, you name it. And so we set out to assess these plans by studying tons of plans, which ones worked well and which didn't. We hypothesized, we iterated, and ultimately arrived at 40 questions that were the most predictive of high performance. You may not be able to prevent a cancer, but you could prevent a $200,000 cancer case from turning into a million, $2 million
Mhm.
cancer case and a bad outcome if you had the right plan attributes. And so there's 8 components of the Health Rosetta Blueprint. We give you 8 subscores. To use a medical metaphor, it's like you get a diagnostic score in these 8 areas, an overarching one. You mentioned Pfeiffer earlier. They were one of the early adopters of that, and thought they were doing a pretty good job with their plan. And they got a 37 out of 100, which is actually probably twice as good as most status quo plans. When we measure them, they get between a 5 and a 17, again, out of 100. Today, Pfeiffer is at 74 because they've just chunked away it. So basically, it's a score. And to torture the medical metaphor, you're basically getting a care plan or a prescription for how to fix your plan. So you get this 30-page report that says, here's why you scored this. This is why this issue matters. Here's what you can do to address it. And then that's where a good consultant can guide people through that or guide a company through that process. And so it really has become this thing. It took us 5 years to develop this and to kind of refine it. But really everything that we've done or will do kind of hangs off of this plan grader because it's like a GPS isn't really useful if it doesn't actually place you on the map. You need to know where you're at so you know where you can go.
You made a big point throughout the case study that employers aren't getting the data they need from the health plan or from the broker,
Yeah.
maybe even especially the broker. How do you know that a broker is acting in your best interest as an employer? And what kind of data should you be getting?
Yeah, I mean, as far as the broker goes, there is a legal duty that the employer has that the brokers and consultants definitely know about. If you don't know about uh, the fact that you're required as the employer to get all of the direct and indirect compensation that broker consultant is getting. We found up to 17 undisclosed revenue streams that these broker consultants have gotten. And that's just not acceptable if you are having a fiduciary responsibility. You'd put you in jail if you were in the financial
Mhm.
services industry, because of all the conflicts of interest. And so you need to get that. If you if you put that out there, first of all, the fact if you don't know that you were supposed to get that as an employer, that's a giant red flag because this has been the law of the land for 4 years now. And if you get any hemming and hawing, it says everything. The fact of the matter is there are financial systems and spreadsheets at the carriers and all these different people who pay them, and they receive those dollars. It's all a bunch of zeros and ones in a computer somewhere. You should be able to get that. And so if you can't get access to that, that's just not the appropriate people to be working with, and you are in violation of the law. It's called ERISA, that's been in place since the Ford administration, but was really strengthened about 4 years ago.
Well, speaking of employee health trust funds, there is some activity, some interest in whether or not they can be held liable for breach of fiduciary responsibility.
Yeah.
And it could extend all the way up to a board of directors to
Yep.
affect them personally. Do you see this activity growing? Is that a real threat? Is that a wake up?
It is. I mean, exactly the refinements to ERISA that happened on the retirement side about 15, 20 years ago, happened 4 years ago. And to this day, about every year, there's about 200 suits in the retirement side of ERISA. There's been two unanimous Supreme Court verdicts against the employer for breach of fiduciary duty. And so the first four of these suits have been filed. And you mentioned the board members. So JP Morgan
Mhm.
was the most recent one. Um, you know, uh, I think it's Ginny or something like that. That was a former um, CEO of IBM. She's one of the board members. She's a named defendant on this, along with the HR
Yeah.
and CFO. And so it's a real wake-up call to boards that that's a personal liability that they
Yeah.
have as a board member, to carefully steward those dollars. And if you read the complaint that details, what's going on, it's interesting where, there's many examples where they're paying $10,000 for a drug that can be had for 300. And these types of things where clearly they're not stewarding the money appropriately. Um, and they're very exposed right now. And so those cases take a while to run their course. And the the firm that has the two unanimous Supreme Court verdicts, they've run ads targeting 20 different companies. You go on LinkedIn, there was like, did you used to work, or do you currently or used to work for, coincidentally, Target is one of the 20 targets. And so they haven't filed a suit yet, but other firms have. And so it's a threat that about 10 years ago I wrote. In fact, it's a chapter in my first book that it was a practice leader of the risk management practice at one of the big four accounting firms that said this was the largest undisclosed risk they'd seen in their entire career.
Yeah.
So it is very serious. Time will tell how it plays out. We've already seen the Department of Labor have far more activity over the last couple years than the prior 20 years probably combined. So it's real and it's coming. And when you talk about 200 companies a year, and now these suits have been happening for over a decade, it's not just jumbo employers who are getting targeted.
Yeah, one of the questions I was left with by the time I worked my way through your case study is that healthcare costs have been a crisis for at least 40 years that I'm familiar with.
Yeah.
And healthcare costs, for whatever reason, many employers, maybe even most employers, seem to park their purchaser frame of reference, their purchaser mentality and their methodology, which really applies right across the board. They somehow park it at the door when we get to healthcare costs, whether it be costs on the provider side or the insurance costs. And this has, just tremendous consequences to employee benefits, employee wages, employee productivity. And the question that arises, why? What's your understanding of why they park their purchaser cap at the door? As usually,
Yeah.
it's one of the two, one or usually one of the two biggest line items in the whole budget every year.
Yep. Yeah. It's usually number two after payroll. And I think it's one of those, maybe it's the frog in the boiling water deal where 30 years ago, 40 years ago, CEOs said to their HR department, keep our people happy, don't get us sued. And healthcare was like, 1 or 2% of their budget. Like their Christmas, party was probably bigger than their healthcare spend.
Mhm.
And
Yeah.
then it just increased. And these people that it's just weird how the industry was set up where people who are paid for by the supply side um, uh, are viewed as sort of objective consultants. And, it'd be like I sued you and also paid for your attorney. That would be pretty crazy.
Mhm.
But it's just become the way things, have gone. And, HR has got COVID, return to office, OSHA. I mean, there's a lot of things on their plate. And again, back when it was a tiny part of the budget, it made sense. But now suddenly, like one of the other stories I wrote about is a company called Pacific Steel and Recycling, and I talked to their CFO. Um, After what they did. And this is a 130-year-old company, slow growth, low margin. And I said, what would you have had to do to top line sales revenue to have the same bottom line impact? He's like, we would have to increase top line sales revenue 25 to 30%. That's pretty tough for a 130-year-old company. And just to give you the numbers there, about 700 employees, decade ago, they're spending 8 million. Them and their peers were expected to be spending about 12 million by today. Their peers are. They've gone 5 years at about 3.5 to $4 million. And that just is dollars that went to the bottom line as they improve benefits for their members. So they remove cost sharing, things like that. And so it's a really potent tool that just CFOs and COOs and CEOs just haven't really been aware of because they've kind of been taken for a ride. And again, they're nice people that are playing that role. And many of them don't know that there's another option, or at least they didn't know. And they're just trying to think, oh, we're doing the best we can within this box that we're stuck in. Well, that box is BS. They don't have to live in that box, and a lot of it's common sense. And now, this new healthcare economy is already bigger than the U.S. video game industry, talking over $50 billion. So, yeah, it's not big compared to 5 trillion, but it's growing very significantly. And, when we started, we launched basically this program with the publishing my book, Labor Day 2017, and I could only find 5 successes around the country back then. Now we have thousands. And it's pretty hard to say we got lucky when it's happened every corner of the country, rural, urban, small employers, large employers, union, non-union, public sector, non-public sector. Not everybody's done all of the things, but there's just a huge movement now. And I think a generational shift is playing in now where 75% of the workforce are now millennials and post millennials.
Mhm.
And, healthcare goes through big shifts every 50 to 70 years. We're overdue, and here we are.
Well, I want to close, but could you at least mention what Health Institute, the Nautilus Health Institute is all about? Who has access to it? How much does it cost?
Yeah, it's free. It's nautilushealth.org. So basically, our theory of change is if you're developing an entirely new industry supply chain, it's got to be a lot bigger than Health Rosetta. You have to develop new um, industry standards. This is like things we take for granted, say in financial services, like with things
Mhm.
like Venmo or ATMs. Like, there's a bunch of stuff happening behind the scenes because people got together and agreed on standards. Or for over a century, the American Institute of Architects developed standard contracts for construction projects. And so we make it freely available. And so the most important proven contracts are the TPA. This is who's processing your medical claims. PBM. This is who's processing your um, drug claims, and then the relationship with that broker consultant, and then the primary care we talked about. We have basically we've made available what we've seen work over and over, which is this sort of virtuous circle. You got to take control of the procurement process, define what you're seeking, codify it in contracts, prove it in data, rinse and repeat. And so there's both the procurement contracts, and then there's also a data platform that if you are going to manage this, you have to be able to take in the claims data, clean it up, add value to it, make it available to different systems. You can't manage what you can't measure, and all the folks who are doing it well, and they're legally required to get access to that data. There are there are battles going on right now, and really literally in the courtroom right now is Kraft Heinz versus Aetna, where Kraft Heinz is like, we got to get access to our data. We have this fiduciary duty. Aetna saying pound sand, and so there's now a lawsuit, and literally they're in the courtroom right now fighting over something that, again, take a step back. Any business I've ever seen in my career that's proud of what they're doing buries you in data and show you all the great things they're doing. And so it's pretty clear that if you're trying to mask the data, you're not adding value. You're actually a value extractor. And so we have to go through a big shift, and that's what's underway.
Well, as a final question, you mentioned every 50 to 75 years the bill comes due, and maybe this is the time.
Yeah.
Are you pretty optimistic?
Um, I'm persistent. And so I am optimistic,
You're
but
probably going to
mostly
get there.
persistent. And so, and the, I hate to be optimistic because of legal activity, but if you look at how there's billions of dollars more in the pockets of retirees and people saving from retirement because of how things were cleaned up on the retirement side, when the government and the players fail to act, then kind of the de facto fourth branch of government becomes these lawyers. And so it's kind of sad that it's gotten to that point. But the dollars are so enormous, right? We waste more dollars in the US healthcare system than the entire Russian economy at a time when there's a lot of need. So there has to be a reckoning. And so, uh, we've said this is unsustainable forever, right? Our whole careers, we've probably heard this is unsustainable. Sooner or later, the chickens come home to roost, and now it's the time.
Dave Chase, thank you for a very interesting discussion.
Absolutely. Thanks for the interest.
Take care.
You bet.